My name is Yasser. I'm a senior lecturer in pharmacy practice and a specialist antimicrobial pharmacist. Today I want to go through a video about why I left working in community pharmacy and moved into hospital pharmacy in the United Kingdom. So unlike a lot of my videos, this video is not going to follow a particular structure, but more is going to be a chat about why I left community pharmacy. Just to give a bit of background, I qualified in 2016, and that's after completing 4 years as an undergraduate student, completing a master's in pharmacy. Once you qualify in the UK, you then have to sit a registration assessment. During that 1 year that you're leading up to the registration assessment, you complete what is called a pre-registration year. Now that pre-registration year is called a foundation training year. That pre-registration year is essentially where you develop experience that you'd need as a pharmacist. You are required to ensure that you meet competencies throughout that year, and then you have a registration assessment at the end of the year, which determines whether or not you can practice as a pharmacist in the UK. By practicing as a pharmacist in the UK, I mean you register with the governing body, the GPHC. During this pre-registration year, I did my pre-registration year in community pharmacy. I completed that year in an independent pharmacy, so that means it wasn't part of a chain of pharmacies. And the reason I did this, it wasn't something that I thought about very much. At the time, I didn't consider hospital pharmacy because I just felt like I didn't know enough about hospital pharmacy. So I didn't apply for hospital pharmacy at all. Now, the pre-registration year, you are expected to go through a process called ORIEL, which we didn't have at the time. So I really didn't know where I wanted to do my pre-registration year, and I knew I wanted to be very quick with organizing that, so that I wouldn't spend the majority of my 4th year looking for a placement. During the summer between the 3rd and 4th year, I started looking for pre-registration placements, and I started trying to ask as many pharmacies as I could, and really I was willing to take on any opportunity that came up just to make sure I was organized for 4th year. So I took an opportunity with a community pharmacy that was an independent pharmacy, and I did my pre-registration year in community pharmacy. Again, not really contemplating whether or not I wanted to go into hospital pharmacy. That was one of the best decisions of my life, I would say. It was a small pharmacy. Because I worked in a small pharmacy, there was 2 benefits to this. One, it gave me the opportunity to do a variety of different roles. Whereas sometimes it's a busy community pharmacy, you really stick to doing the same role for the majority of the year. I've heard people complain about that. Whereas I was competent in doing a lot of the processes within that community pharmacy. The second opportunity was the fact that it was a relatively quiet community pharmacy compared to other pharmacies around there. And this gave me an opportunity to spend more time learning and spend more time developing the skills that I needed for the registration assessment. When it came closer to the registration assessment, I then started to look at the possibility of moving into hospital pharmacy. I was hearing a lot of good things about hospital pharmacy from friends that are doing their pre-registration year there, and I thought it would be a great opportunity, but the competition is extremely high. And that's why I thought the likelihood of me getting a place in hospital would be difficult, but if I did get a place in hospital pharmacy, I would take that opportunity immediately. I applied for a junior pharmacist role as a cardiorespiratory pharmacist, and I will put a link in the bio of tips that I have for going into a hospital pharmacy interview. One of the reasons why I wanted to move into hospital pharmacy was the amount of information that's available to you. The fact that you have the information of blood test results, you know what the patient's kidney function is doing, you know what the patient's liver function is doing. You have all that data available to you that will determine whether or not the medication is suitable. A lot of that information is not available to you in a community pharmacy, or it's a lot more difficult to get that information. So this is something that's very common. The other thing is you work very closely with other multidisciplinary team members. So for example, you work very closely with physiotherapists, with doctors, with occupational therapists and nurses within a hospital pharmacy setting, which was a lot more different in a community pharmacy setting, and it's a lot more difficult to have a conversation with the prescriber. In many cases in community pharmacy, you won't know what the medication is being prescribed for unless you would take a look at the patient's records, or you would have a discussion with the patient. There have been a lot of changes in community pharmacy now, but about 5 years ago, there's a lot of information that wasn't available to you, and the systems that are in place now were not available to you at the time. So although there were extreme benefits of working community pharmacy, having that close patient relationships, seeing the same patients every month and being very familiar with how you manage their care, being that person that is at the forefront of healthcare where you're easy to reach and essentially a patient can walk in at any time and have a discussion with a pharmacist. Those are some of the benefits as a community pharmacist. At the same time, I wanted more information about the patient and to be utilizing more of the information that I had about medications. So having a knowledge base of which medications can be acutely prescribed in a patient that has renal dysfunction, so their kidneys are not working as well as they should, is something that I wanted to use that information and I wanted to use the knowledge base that I had to ensure that the patient's medication that was acutely prescribed was appropriate. This is part 1 of the video. In part 2, I will go through other factors that determined why I moved from community pharmacy to hospital pharmacy. If you're considering any of these roles, drop a question in the comment section below and I'll be able to answer those questions later on. Thank you very much for watching. I'll see you in the next one.